Remote therapeutic monitoring is the ability for healthcare providers, and we're working on the chiropractor side to validate this, but physical therapists, nurse practitioners, physicians can literally bill for creating, sending, and remotely monitoring what your patient is doing. It's remote monitoring of self-reported musculoskeletal information. So it's not data-driven like physiological monitoring. This is therapeutic.
All right. Genesis Nation, welcome back. And I am super excited today to have with us Dr. Dave Cruz with WebExercises. And I'm looking at you and I'm looking at Dave. And you've just done amazing things for the profession, man. You've bridged the gap between movement and chiropractic. And myself, I'm a kinesiology major, NASM, Paul Check. Like I've done a ton of movement study and we've known each other for, a couple decades now at this point, which is insane. And have always, shared that common view of understanding how important movement is on top of a healthy spine. And as chiropractors, it's not always the common thing, but what you've created is an amazing pathway for people to learn about this, not just learn about it, apply it. And not just apply it, but apply it as an integration through Genesis. So if you could just give us a little bit of background of how WebExercises was created, and then we'll jump into actually showing our users how to get this thing in action.
Sure. No, absolutely. Thank you so much for having me. And excited to kind of give a demo and show everybody how easy it is. It really all started back 15, 16 years ago because, I'm a movement geek like you, right? That movement matters, right? And so it's always a matter of how do I get people to incorporate exercise with chiropractic care, because you get the best outcomes when you combine the both. Chiropractic care is great. Exercise is great. But if you look from an efficacy standpoint, when you combine chiropractic with exercise, you get superior outcomes, superior results. And so there really wasn't anything on the market. So actually I had a software engineer as a patient just said, hey, how can I deliver photos, videos? We started talking, and that's kind of where it was born, with the idea of give people access any time of day to the specific exercises you docs prescribe in the office, right? So it's great they're in the office doing some exercise, but when they're outside working, the home life and so forth, if they're only seeing you once, twice, or maybe 3 times a week in the beginning, and you're slowly going to wean them off care over time, they need to be doing something too. So how do we make it easy for them? And that was really the whole goal. How do we engage patients more to move more? And whether it is just from a health style, lifestyle, or specific rehab, that's where I want to make sure this is not just for, like I said, movement geeks like me and you. We can talk about this stuff all day long. It's really essential for docs that don't know a lot about exercise, but they know, hey, I know I should be doing something for my patients. So we make it really easy for them as well, because whether somebody's in a rehab standpoint or a general health, exercise is critical. If you look at the 40 top chronic diseases, every single one of them is helped with some sort of exercise. So whether it is for general wellness or rehab, exercise is essential.
Awesome. I love it. And you've just made it simple. And especially for those who haven't, geeked out, like we haven't gone into like excessive courses of study. You've made it really simple. So I would say let's just dive into it. Let's take a look, and we're going to show you exactly how you can access WebExercises through Genesis. Now, this is an add-on for those of you who are already Genesis customers and clients. WebExercises is an additional integration, but you'll see how simple it's built right into the program, tied into the patient, and Dr. Cruz is going to show you.
Perfect. Let me go ahead and share my screen. I'm going to bring it on up here, and you have my screen?
Yep. We're at the document bill station.
Yep.
If those users out there are using our old note system, let's make sure we get you updated on this new doc and bill system, and so you have this quick access to WebExercises.
Yep. So once you're in the document and bill section, on the right side, you're going to see this little icon, this little man, and then that's where we are, the exercise WebExercises. All you got to do is once you're connected to the system, and you can get to WebExercises through the App Store, and Brian can can talk more about that, or the Genesis team on how to get it active. But once it's active, you literally just go here and you click on that, and the patient that you have the account up for, it's going to go straight into their account. So this is just a test account, as you can see. But if Brian was a patient, you're documenting everything in EHR. When you click Web Exercise, it's going to go straight into that profile for him specifically. So let me kind of give you just a high-level overview of it. Then I'm going to take you through. Let's talk about maybe you have a low back patient and then maybe a neck patient. I'll show you actually how those exercises are created and then sent out to the patient. And so over here's an exercise search. Now, you can find exercises in a variety of ways. If you just click the tab, you can come over here and get a sense of what our library is. So you can do an exercise search a variety of ways. Maybe you have a patient with sciatica. You can actually start typing in some keywords, and it'll actually call up some recommendations, and then it's going to display recommendations for that condition. They have photos, video as well. This is what gets sent to the patient. So as a clinician, we want to get the patient the right exercise, like I say, for the right condition, gets the right result. So this is not just a general platform that any patient can go to find, exercises like they're searching Google. No, this is specific to their condition. And so that's what you as docs do, is based on that clinical profile, you're going to find exercises. Maybe they have a shoulder issue and you want to find some exercises with the resistance band. So you scroll down to TheraBand, click that, and then go ahead and hit search, and it calls up exercises with the TheraBand, right? So you're going to pick those specific exercises based on what that patient needs. And it's like I said, it's a very robust search engine. There's different categories. You can slim it down because there's close to 4,000 exercises. So it really helps if you use the drop-down menu to try and refine that search, like exercise stretch. Myofascial release, for instance, I'm just going to select all body regions, is a self foam rolling. So
that's cool.
Hold on a second. Oh, I got to go to let's go hip. Myofascial release. Oh, it's with a TheraBand. Nope, we got to clear that out too. So I'm going to go body region. Boom. So here's some foam rolling, right?
That's amazing.
So
and all of these
on what you want to apply.
And we're able to email all of these out to the patient directly from this portal.
You're exactly right. Email and print, and I'll show you exactly how to do that. There's certain body position. You know what? Hey, let's say a patient's really acute. I only want them doing things, sideline or supine. So kind of use that clinical assessment to find these exercises. We have different libraries from general conditioning. We have for more specialties of nerve glides. We have pediatric, pregnancy. So we try and make it specific. So let me show you just kind of like the pregnancy library, for instance. I'm going to go here. Oh, wrong one. Library. Pregnancy library here. Make sure those are cleared out. I hit search. Let's get rid of the fascial. And then here we go. Here's some exercises that are more targeted for pregnancy. Okay.
It just makes it makes it so easy. I mean, I can remember printing it. I can remember like searching on the internet, trying to find all these exercises, creating my own books, and then taking pictures of myself and videos. So, man, thank you for this.
So we try and, there's a reason for everything, a method to the madness, if you will. This is built from a clinician's perspective. When I practiced 20 years, I know what the pain points are with efficiency, what you need to document from a med legal standpoint and so forth. So that's what we really try and bring, is really a robust platform that's efficient, time-saving. That is technically a medical record as well.
Awesome.
Over here, let's just say, actually, a couple things right here. Protocols, we make it even easier at times. I'm going to scroll down for a second. I'll come back to these in a moment. But we have close to 100 evidence-based protocols that are progressively strengthening. So let's say, like I was talking about, that doc that doesn't have a big rehab background, but has some general exercise, knows I need to get some exercises for maybe a soccer player that came with a sprained ankle. Well, here you go. Is it phase 1, phase 2, phase 3? And it just makes it really easy to find the exercises that need to be done for that condition. The other thing is those CVP docs. The CVP library is an add-on which we can add to this, where you're able to find exercises specific for dental, mirror image exercises, and so forth, and even some protocols that'll make it much more quick for you. I'll go ahead and create a program as well, just to kind of show you how that works. My exercises, let's just say that, you know what, Brian, you're the exercise geek, and you go, Dave, you got 4,000 exercises, but I need 4,001, okay? Because you don't have the one I want. Well, it's pretty easy. You basically can add an exercise by putting the name in, not sets, but is it, body region, equipment, what are you using? Type in what sort of start position movement, upload your own photos and video, and then that becomes part of your own private library for your account.
That's awesome. Yeah, I love it. I love it. That's really cool.
We have some educational content here just to kind of get patients engaged. For instance, these are designed to just be a general overview for healthcare providers that just give patients a handout on, hey, what's a disc herniation, for instance. So we just try to make things easy, or, what does foam rolling do? Like we were talking about this, hand this out to the patient. You know what? Here's some foam rolling. I'm going to give you some specific exercises that targeted towards your condition, but here's an overview of it. Okay.
Great.
So again, just some time-saving things. Let me get into how to create a program, for instance. So I'm going to go back to my dashboard.
I mean, it's awesome. It's all just it's just at our fingertips, like right at your computer at the table. It's right there.
And and that's why to me the integration's a no-brainer, because you're in the EHR. I've got to do this for the exercise prescription, get to the patient. Well, it's all right there in front of you, right?
Love it.
So what we want to do is, these are all completed. So it's going to tell you if a past program is completed or canceled. It's going to give you the running history of every program you've ever done. So I'm going to create a program. Let's say you have that low back patient, right? That low back patient's coming in. Maybe they're doing better. Now I've got to start getting them some strengthening exercises. We've got to stabilize that core, for instance. Well, we can do a few different things. We can say, what protocol do I want to start with? Or do I just want to find some exercises, okay? So if they had a low back strain, I could start with this. Let's just say they're doing pretty well overall. I'm going to load in a phase 2. What it does, it auto loads exercises. Let's say, you know what? I don't want to give them this many. We want to start simple. So I'm going to get rid of a few exercises here. And then let's update that. Let's kind of get rid of that. Let's say, I need some core exercises on top of this. So we're going to go add exercise, brings you up to your search page. Core here, search. And then here you go. You have 213 core exercises to choose from. Wow. So let's just, maybe we got to add in a progression of a dead bug, and then, a plank, for instance. That's what we want. Return to our exercise summary here, where we kind of list what we want to do. I can drop and drag, like, I want them to do this one last. So we're going to actually drop it to the bottom. We can move these around how we want. I'm going to have them do some foam rolling at first to kind of loosen up. Move that around. You can type in any specific comments you want, as well as how many sets, reps, and frequency. If this is what you want, we hit continue. And now we get one last look, because this is what we want for sure. We review it, and yes, finished, done. So that's simple. From here, I can print these exercises, one exercise, 2 or 4 per page, depending on what you want in your office. Or I hit email. When I hit email, that's going to send them a welcome email. You have a new exercise program, log here to log in. So it's going to give the link to log in, or they can download our mobile app and access it that way. When patients actually submit feedback, because they're going to get the program, and actually it's going to say, how many reps have you done? Do you have any feedback? And so they actually need to be accountable. They need to put in, and you need to let them know, you know what? I want you to let me know exactly how many reps and sets you're completing. Let me know if you have any pain, any difficulty, and they will go through that and submit feedback to you. So you'll actually get notified if that patient did provide feedback. You'll get an email that says, yes, this patient provided feedback. You can go in and see that.
Great. I'm going to give us a little foreshadowing on remote therapeutic monitoring, RTM. So we're not going to dive into that now, because I know it's the Wild West out there for RTM, and
Yep.
but your program seems perfectly suited to be able to,
Yeah.
if you're within compliance and all that kind of stuff, but like being able to bill out for home exercises and get reimbursed for that.
Correct. Here's a 60-second overview condensed down from about a year of learning.
Research. Yeah.
Remote therapeutic monitoring is the ability for healthcare providers, and we're working on the chiropractor side to validate this, that physical therapists, nurse practitioners, physicians can literally bill for creating, sending, and remotely monitoring what your patient is doing. It's remote monitoring of self-reported musculoskeletal information. So it's not data-driven like physiological monitoring. This is therapeutic. It is a little bit of the Wild West. And it's, again, there's a lot involved, but we're compliant on everything that needed to be done. So if there are some practices with physical therapists, we know right off the bat, physical therapists are getting reimbursed for this. We're still testing the chiro market, but I have a feeling before long, it's going to kind of be the industry standard, being able to basically get paid for what you're already doing, essentially.
Yeah, of course, of course. And this, we'll have to do a part 2 on this once we get more data in on the chiropractic side, because obviously, with Genesis, we are seeing a lot more chiropractors, our clients, but and we want our, if you're in the insurance game, you should be getting reimbursed for these home exercises. And once Dave and his company and his people figure that out, through Genesis, we're certainly be able to help you build that and get reimbursed for it.
Yeah, absolutely. And that's where, when it's all connected, it's again, makes sense. It's a no-brainer. It simplifies things.
Awesome. Well, yeah, go ahead.
No, I was going to say, I can take, I know there's some CDP docs.
Sure, you can give us
probably just more than some that utilize Genesis. So if you had a question, I mean, we'll just, go ahead and shoot. I was going to actually kind of show a little bit of the CDP library for some of those docs.
Yeah, let's do it, please.
Let's just go back to the dashboard. Let's just assume this is a different patient. I'm going to actually take this. And here's one thing for all patients that you create a program. Say 2 weeks later, you want to revise it, or a week later, it's a current program. All you got to do is come here, hit edit. And at this point, it brings it up. How do I want to edit it? Do I want to remove some exercises, add some new exercises? So it's as simple as that. So when you come in, it's got a record. You basically say how you want to change it, how you want to update it, and so forth. I'm going to basically get out of this and cancel this altogether. So this is totally canceled. Create new RXs here. So let's assume this is a new patient. Let's talk motor vehicle accident, okay? Motor vehicle accident, post-whiplash, post-acute. They're kind of in the subacute. We need to use some postural. We also need to maybe get the dental, right? So let's do this. Let's go create new RX, and we're going to basically take some of those CDP protocols. I'm going to show you 2 different ways that we do this, which I kind of like. So one way is basically going, okay, what do I want? Some mirror image cervical exercises. So this auto loads, and here's the good thing, guys. I have Deed Harrison actually almost committed to reshooting a lot of these older content. So the pre-made protocols is going to add a lot here. So I'm going to show you a way around that, which makes just a lot easier, because the protocol brings up the whole library and for you to choose what you want. So I'm going to kind of show you, here's the trick of the trade right here. I'm going to get out of here. What I want you to do is this. If you have a protocol, this makes it pretty easy. So I'm going to go to exercise search. Now down here, favorites from protocol, okay? This makes it easy. So I'm going to go choose. If I go down here and I say the mirror image exercise is cervical, okay? And I hit show that. It's basically going to pull all these up. Now, all I have to do is go, you know what? I want this one and this one, and add it to my program. Great. So instead of getting the whole list and say, let's remove, if you have a long list, this is a little bit easier way to go, because then you just choose the ones you want, okay? So let's go, for instance, how about dental? You know, if they need a cervical dental. So I'm going to hit show, and it's going to pull up the dentals. And how about just the mid-neck right here, okay? And then how about we'll go one more thing here. Let's go to let's say we have some of the prolordotic in here.
Great.
So, and let's go here. Let's choose this one here. I'm going to now return to my RX. Yep, these are the things I want, right?
It's awesome.
Set reps change. We want them to do the general last. I'm going to slide this up, okay? I'm going to do this, right? We don't want them to do this that long. So you're going to do one set, one rep, for instance. But depending on their tolerance, right, we're going to have, they're up to maybe 5 minutes now, for instance, if we work them in slowly. And we want them to do this, right, daily. Or you want them to do it 2 times a day, right? Depends on what we need. So we can get real granular if we want.
My brain is geeking out right now. I'm loving this.
Same process. We go continue and then finish. And I'm done. Same thing. Do I want to print them in Office? Do I want to email them out?
Yes.
Yep.
All of it.
Yes. all the above.
Yeah.
So that's kind of an overview of selecting exercises either from a protocol or kind of the other way around through the exercise search, and we call it the favorites, because you kind of just choosing your favorites to build the program.
Okay, so we can build like a list of favorites. If I know I'm giving like typical classical forward head posture, which most people have, whether I'm a CBT doc or not, I can give out that immediate protocol almost day 1, day 2 if they're not acute.
Yeah, and if you find, you can build your own protocols too. So if you find you always go, these are my starter 4 or 5 exercises, then literally you just go to that protocol, click it, it auto loads it, you're ready to go, done.
Awesome. Very cool. If you want to stop your screen share so we can close this up, because this is just, for those listeners out there, we just wanted to provide an overview for this. We definitely have the ability to dive further into this, but it's so intuitive and so simple. If you don't have WebExercises integrated, I definitely would suggest to consider getting it integrated to give it, because obviously the data is out there, right? We know that patients are living longer and healthier lives when they're exercising and getting chiropractic care together. So, I mean, it's a no-brainer as far as I'm concerned. And I want to say thank you, man. I don't know if you get a thank you, but thank you for like doing this, adding this. You're adding more validity to our profession and helping us be better practitioners. So thank you for putting this work out there, man.
No, I, you know what? It's just like you, exercise is a passion. Everybody can benefit. I appreciate Genesis. Appreciate you giving the opportunity because, yeah, it's a win-win. If people move, movement matters. Movement helps. And we talk about the benefits of chiropractic. Yep. And when we combine it with that, with exercises and WebExercises, yeah, there's nothing better to really help your patient feel better and live better.
Great. Well, it's honestly like I love hanging out with you, and I love being able to put this stuff out to the Genesis Nation. So, Dr. David Cruz, WebExercises, thank you so much for your time and for your tireless efforts for always putting this work in, man. And we look forward to continued collaboration.
Oh, absolutely. Thank you very much for having you. All right. And anybody can reach out.
We'll put everything. We have it all. Yep. This is going to get blogged out, emailed out, Facebooked out, Instagrammed out. We got you.
You got it.
Yeah, and you know where to reach us too with Genesis Nation, or you can always reach me, Dr. Parison, at Genesis Chiropractic Software if you have questions specifically about the exercise and that kind of stuff, and I'd love to help you out with it. So, right on, man. Thank you.
All right. Thank you so much.